Hi, I'm Dr. Andrea Furlan, a physiatrist and pain specialist in Toronto. In another video that I made, I mentioned that the 5 M's of treatment for chronic pain include medications, mind, movement, modalities, and manual therapy. Today, I will explain what the mind-based therapies are. Some examples are cognitive-behavioural therapy, mindfulness meditation, hypnosis, and acceptance and commitment therapy. So let's talk about mind-body therapies for pain. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and is not merely the absence of disease or infirmity. I conceptualize diseases as infirmities using a biopsychosocial spiritual model. In pain medicine, we use this model to treat the individual as a whole, and that's why we recommend an interprofessional team to assess and treat individuals with chronic pain. Some professions will focus on the biological aspects of pain, like doctors and pharmacists. The physiotherapist may work with fear of movement, which is a very common psychological challenge for people with chronic pain. The nurse may work with them on increasing their social supports, and our social worker may help the person to reconnect with a faith-based group and help them find purpose in life and meaning to their suffering. The mind is where our feelings, thoughts, and desires are processed. Our minds are always telling us, I feel, I think, I want. We feel pain, we think about pain, and we want something. Usually we want the pain to go away. Unfortunately, the more we think about pain, the more memories we are creating in our mind. And it's really hard to get rid of memories, especially memories of pain. Therefore, we need to learn how not to think about pain and distract our minds with other more interesting things. There is research that shows that our emotions determine how much pain we feel. So the same painful stimulus or injury will seem worse when we are sad, and it will seem less intense when we are happy. If our brain is distracted with other tasks, we may be less aware of our pain than if our attention is focused on it. Especially if we are frightened or angry about the pain. Our brain may also get overwhelmed with feeling pain all the time and stay in a constant state of hypervigilance. And it's very common in some chronic pain syndromes like fibromyalgia and CRPS. I have another video that I explain fibromyalgia and one on CRPS that you can access. There are aspects of our personalities, the way we were raised as a child and previous experiences in our lives that make us all different. These differences also affect how we perceive, how we communicate, and how we cope with pain. For example, some people are more optimistic in general. They are the kind of people who are able to always see the bright side of things in life. We know that people who have this kind of personality tend to have a better recovery from acute pain. If they develop chronic pain, they are less likely to have disability or the chronic pain to be very debilitating. On the other hand, people who are more pessimistic, who worry more, or even imagine the worst, are more likely to develop chronic pain, but also to suffer more from their pain. There is a questionnaire to assess this personality trait. I don't like the name they gave to this trait because it says the people who are more pessimistic, they are catastrophizers, which means they tend to see the potential for a catastrophe in the events in their lives. Well, the good news is that there has been research over the past 50 years conducted by psychologists and psychiatrists from all over the world and who have developed a number of treatments that can help the mind aspect of people with chronic pain. We are now very fortunate to have various options for improving the I feel, I think, I want functions of our mind. I will summarize some of these strategies that have the most evidence of effectiveness from research studies. So, cognitive behavioral therapy, or CBT. The cognitive part is about what we think. the interpretation that we give to the things we are feeling. Sometimes what we think about is not correct or helpful. I see people with chronic pain all the time who have wrong thoughts and need someone to help them to think about what they are thinking. This is the cognitive part. The behavior part of CBT, the B in CBT, is about what you do when you have chronic pain, such as activity pacing versus overdoing. Now, if you're now thinking differently, you're ready to do things differently and get more enjoyment and less pain in what you do. CBT is often offered by psychologists or trained mental health counselors. Unfortunately, this can be very expensive therapies. However, more recently, therapists have developed online groups for CBT and computer-based CBT. Many of these are free and very low cost, and research indicates that they are as effective as CBT delivered by a professional face-to-face. I recommend CBT to many of my patients. Let's talk about biofeedback. Biofeedback involves a device or a machine that measures the stress response of the body, like the hand sweats, the heart rate, or the blood pressure in real time. Then these measures are transformed into a visual scene or an auditory sound that is presented to the person as a marker of their stress at the moment. Then the person learns techniques to reduce their stress levels, and they see or hear the feedback from the machine or device in real time. It's not only about relaxation, but it's also about shifting attention and promoting an objective and precise understanding of what is going in both the body and the mind and how they influence each other. Biofeedback treatment has been shown to be effective for pain in children and for phantom limb pain, which is a pain in the limb that has been amputated and is therefore very hard to treat. The main problem with biofeedback is that these sessions are usually very expensive. Let's talk about mindfulness now. Mindfulness is sometimes referred to as mindfulness meditation or mindfulness-based stress reduction. This group of therapies are focused on building awareness and accepting of here and now experiences, including pain and emotions. The person is trained to feel these body sensations and emotions in a non-judgmental way. The benefits of mindfulness for pain are usually achieved in people who practice meditation every day. The meditation training sessions are usually done in a group and may involve 3 components: a body scan to pay attention to the entire body from feet to head and all the sensations coming from the body. Then a sitting meditation, usually involving breathing exercises. And then finishing with some stretching or posture exercises. I have many patients who were able to reduce the use of painkillers just with doing meditation. And they tell me that one session of meditation is similar to taking 1 tablet of their medication. So I tell them just to change 1 letter, change medication by meditation. Again, there is research from around the world that supports the effectiveness of mindfulness-based therapies. So now let's talk about yoga. Yoga is very similar to mindfulness-based therapies. It places emphasis on mental fitness as well as physical fitness. It combines breath control, meditation, and exercises to strengthen and stretch the muscles. There are many research studies showing that yoga is helpful for people with low back pain, fibromyalgia, arthritis, and migraines. The main advantage is that there are many resources on the internet teaching yoga, and my patients can access this from home. I tell them that they need to practice for at least 45 minutes a few times a week to notice the benefit for chronic pain. But there are so many types of yoga these days. Some are more vigorous and done in a heated environment. I tell my patients to be careful and really talk to the instructors and ask if that type of yoga is appropriate for people with chronic pain. Let's talk about hypnosis and guided imagery. There is evidence from medical research studies demonstrating that hypnosis is helpful to reduce the perceptions of pain in our mind. It's also helpful to reduce pain unpleasantness and use of opioids. There are many studies showing that in surgical procedures or acute pain, the perceptions of pain were much reduced with hypnosis. Hypnosis involves entering an altered state of consciousness through a focused attention and helpful suggestions. The component of suggestions help changing thoughts, emotions, and sensations, which is basically using suggestions to change what our mind is saying, I feel, I think, I want. I remember a young patient that I saw many years ago, who told me that he had stopped using his opioids for chronic pain. So when I asked him how he did it, he showed me an app on his cell phone. It was installed, an app for self-hypnosis. So he told me that every time he had the pain and an urge to take his opioid, instead of taking his short-acting opioid, he turned the app and did a self-hypnosis. He does not need to use the opioids anymore. I was amazed, but not entirely surprised, since the research supports what he told me. Guided imagery involves active imagination of visual, auditory, and body sensations and perceptions. Both hypnosis and guided imagery aim at reducing pain by using a focused attention and imagination to superimpose sensations that are pleasurable on the painful body areas. It seems that these two therapies work better for acute pain condition, but clearly can be helpful for some people with chronic pain. Acceptance and commitment therapy, or ACT, ACT. I recommend many of my patients to go to ACT. This therapy emphasizes the importance of accepting pain and focusing on goals that are important to that person. I like this type of therapy because it is very goal-oriented and personalized. Each person has a different goal or many goals they want to achieve. They want to achieve now, next week, next month, next year. I see many of my patients with their lives on hold because of the pain. And I feel so sorry for them because they are missing out on important functions. They're missing a nice family reunion or the graduation of their children, the vacation trip, or postponing their careers. ACT has been transformative for many of my patients. They finally accept that their pain is here to stay, and they move on with their life goals because they are in control of what they can and cannot do, not the pain. I remember one patient that finished her ACT sessions and returned to see me for a follow-up visit. She was so different and happier. She didn't even want to talk about her pain with me. She only talked about her life. And when I asked her, how is your pain? She said, well, it's still here, but I don't pay attention to it anymore, so it's not bothering me. I have so many other things in life to do. I don't have time to marinate in the misery juice anymore. ACT is a fairly new treatment, but it has grown a number of research studies supporting its effectiveness for helping people with chronic pain to get on with their lives. So to summarize, pain physicians like me, we need to understand these mind-based therapies and recommend them to our patients with chronic pain. And for patients with chronic pain, when I send you to a mind-body therapist or a psychologist, please do not interpret this as me saying, I don't believe you have real pain, or I think you are inventing this pain because there's nothing wrong with your body that I can detect. I'm trying to help you and need to treat you as a whole. I believe we are spirits with minds living in a temporary body, and that's why I use a holistic approach. Now, please remember that this video is not intended to provide medical advice. It's only for educational purposes. If you have pain and you think you need any type of mind-based therapy, please consult your doctor or a psychologist to get professional advice and a treatment plan for you. If you like this video, don't forget to like it, to subscribe to this channel, and to turn on the notifications so you can be alerted when I post new videos. I also tweet, I have a Facebook page and an Instagram account. You can contact me there. Bye for now.